to this webinar, to panel discussion on future of public health, and we'll be discussing primarily on the idea of technology and how it will possibly have an impact on future of public health. We are just waiting for our fourth panelist. We should be beginning any moment now. Just waiting for him to join in. Allow me a few minutes, and we should be live here back soon. Meanwhile, if you have any questions, you can feel free to put them in the chat. In the Q&A section at the bottom of your screen, you can put in your questions there. And while we answer them, we can keep going and see the answers there as well. We would also are streaming live on YouTube, so feel free to share the link. This particular link was only for people who have pre-registered and sent their registrations over to us on email. So welcome all to the webinar again, and allow us just a few minutes to initiate this. Thank you. Yes, welcome all again. It's an exciting evening. Overall, in the middle of a week, when we do something like this, we are often afraid what might go wrong. There are immediate urgent requirements for people. There are immediate office deadlines. There are immediate work requirements. And I'm so glad to see all of you coming together. I can see some doctors. I can see some Army General. I can see some of my own team members. I can also see a lot of young people whom I have had the chance to meet as part of this panel discussion and the audience. And I'm glad to be joined by two of my panelists. Hopefully we'll be joined soon by the third panelist as well. I'm glad to welcome you all and thank you all for joining. Overall, just to give a quick theme of the panel discussion and set the context. Within Sewa International, we have been working in the field of health for long. We have been running MMUs, there are health camps that are organized, there was mass vaccination drives. All of this are a way to assist the bigger setup of the government and the private sector to provide the health opportunities. However, we have often seen health as one field which is not easily scalable. So you can't easily scale from one PHC catering to 5 villages to one PHC catering to 7 or 8 villages. It's not so easy to increase the demand for a doctor, increase the handling capacity of a doctor without reducing the quality a little bit. Often within the last few years, there has been a discussion to include technology in it. Just a few days back, our Honorable Prime Minister launched Ayushman Bharat Digital Mission, and that took a lot of attention. We have lost Ayushman Bharat long time back, and that also saw a lot of attention. We saw health stack being discussed within Niti Aayog circles, and that generated some waves and some discussions within the policy and the health sector enthusiasts. However, technology so far has taken a very, very small percentage or proportion of India's overall public health situation. Some research by independent researchers mentioned that telehealth is still only 0.2% of India's public health. Is it going to increase? Is there any chance in which we are going to change the scenario? Is there any way in which public health can be impacted by technology? And overall, in terms of just public health, what kind of changes we either see or foresee ahead is what the topic of this panel discussion is. We are going to have this panel discussion for around an hour. And within this hour, we will have the first 3 minutes to each panelist for their introductory note on what do they feel about the future of public health. We would go ahead and have some individual questions for each panelist based on the backgrounds they come from. And eventually at the end, we would love to take some questions from you. So feel free to put your questions anytime during the conversation in the Q&A portal of your screens. So just to begin, I will just introduce both my panelists to you. We have Dr. Yogendra Malik ji with us. I have personally known him and looked up to him as a health expert for the last 7 years. Dr. Yogendra Malik ji is a doctor himself, and Jumped into the public policy space and joined as advisor to the Honorable Chief Minister of Haryana. He was very, very instrumental in creating the Beti Bachao Beti Padhao campaign and drove it not only at the policy level, but also at the implementation level to the grassroots, to each Anganwadi and each village. Beyond that, he is part of some mega initiatives in the country, from National Medics Organization to Arogya Bharati. He is currently part of National Medical Commission as part of its ethics board as a full-time member, and is responsible for ensuring that our medical professionals act to the best of their ethics, and also ensure that the overall health situation in the country gets monitored by a bigger authority and gets regulated in some form. Being independent professionals, it's often difficult, but to ensure that the policy side of it is uptight. That brings a very unique juncture of public policy and directly being a doctor himself. So welcome, Dr. Yogendra ji, to this panel discussion. I'm glad that you accepted the invite, and we're glad to have you here.
Thank you so much.
We also have Aman Manchanda ji with us. Aman Manchanda ji is a part of AXA team. AXA globally has been a domain leader in the field of insurance. And India, especially in the reinsurance sector, they are a market leader in themselves, working with various state governments, central governments to ensure ensure in both ways, to ensure the people as well as to ensure that people are getting the benefits of a health insurance. He has more than 20 years of work experience, with 18 years only in the insurance sector. In mass health campaigns, often there is a lot of data, there is a lot of learnings that happens on the field on what people feel, what people go through, what kind of problems and challenges they face. And he would be talking about his experiences in the private sector, seeing the public health situation in India change over the last 18-20 years. So glad to welcome you here, Amanji, and a pleasure to have you on the panel discussion as well.
Thank you so much, Yogendra. Thank you so much for having me here.
Thank you. So Yogendra ji, let's begin with you. Your introductory note on the topic. The future of public health is technology or solution.
Yeah, thank you so much, Shubham ji. Am I audible? Hope I'm audible. And then, thank you so much, Sewa International, for giving me this opportunity to interact with such a distinguished audience. So I'll start by quoting from a book by David Robson, The Intelligence Trap, in which he quotes Ted Friend of New Yorker, and he says, in the 1920s, an engineer's half-life of knowledge, that means the time it took for half of his experience to become obsolete, expertise to become obsolete, was about 35 years. In 1960s, it was a decade, and now it's 5 years at the most. And for a software engineer, it's less than 3. That's what he said about engineering. I could not gather such a data for my field from doctors, but from my experience, I can tell you that that too has considerably less compared to a decade ago. When we were doing MBBS, we used to have next edition of the book maybe after say 5 years, 6 years, 10 years. And now we have CMDTs and CSDTs, the new books coming every 6 months, the advancements coming every 6 months. So that's how the science and technology, they have, they have grown and by leaps and bounds. And so this technology has helped to reshape the landscape and made lives of all of us healthier. And it's no more a surprise for any one of us. Access to medical education has considerably improved. We have better treatment options, better equipments, better medicines, and obviously faster diagnostic results. 20 years back, who could have imagined that this RT-PCR, which we are doing right now in this COVID pandemic, will become so common? PCR used to be, polymerase chain reaction used to be a huge test involving huge cost and huge machineries, and now we are doing in maybe in lakhs daily. So that's what technology can do to us and our lives, and obviously to the health sector. Digital technologies specifically are being they are harnessed to support public health response to COVID-19, like population surveillance and case identification, etc. To give you an example, who are non-medicos, you all have this Arogya Setu app in your mobile phone. So that's a kind of technological help we got in this COVID-19, and then contact tracing and evaluation of intervention on the basis of mobile data and mobility of data, and then the communication with the public. So we have come a long way during this COVID pandemic. Even WHO, World Health Organization, they came out with some of the guidelines on the technology and the public health, how it can help it in 2019. And these technology, but we have to remember, they cannot work or operate in isolation, and they need to be integrated into the existing public healthcare systems. That's the most important thing I would like to emphasize. And then again, we are aware that data sharing has become very easy nowadays, and the quality of data, specifically when we were young. I don't say I'm not still young, but still 2 decades back, we always read in our books that the quality of data in India is not good. But now what we are, eventually in the discussion, I'll come to NHA and National Digital Health Mission. The quality of data in India has also improved a lot. And, during COVID, you must have come across, though these are not new words, but they come into the being and awareness of the people during this COVID pandemic. They are telehealth and telemedicine. They have come up in a big way, and especially during this COVID-19 pandemic, and helped us to reach the last person in this country. When nobody could come out, we use this technology to kind of alleviate our sufferings and pain in the remotest part of the country. Many startups do have they have come up with many new solutions in health sector, specifically due to this pandemic. So I think technology obviously public health as a future, and the technology will definitely play a bigger role into it. That was I wanted to set the note for it. Like Shubham asked me, I leave it to the next panelist, the Honorable Dr. I think Aman Manchandaji, to have his opinion on this.
Thank you, Dr. Yogendra. Beautifully said. Often the reflection of how we have changed is in the textbooks. We have often criticized the textbooks for taking such slow changes. And if they have exponentially increased the way the books change, that showcases the way our world around has changed. Thank you, Yogendraji, for sharing that. Amanji, over to you.
Thank you, Dr. Yogendra. Thank you, Shubham. Yes, I mean, we started with the public health. Public health of late has got a lot of traction, especially in this COVID times. If we see, a lot of system has to come into play, especially when you talk about vaccinating, 1.3 billion population. It is not possible without the public health system in place, and especially a lot of organizations who are working towards it. Technology, yes. I agree with Dr. Yogendra, and I would say that technology is the way forward. Technology is the only way we can achieve or we can scale, our public health. It is very difficult, even in these times, to have a physical meeting with the doctor. If we talk about, the rural areas, it's not very, very easy for them. Still, the clinics are sometimes 30 to 40 kilometers away from their homes. Whereas if we talk about technology, of late, what we have seen is there are close to more than 740 million people in India who are accessing the internet, and most of them are accessing through their telephones. So, can we provide a solution? Yes, the solution is there. It is the virtual proximity between the doctor and the patient, which can help a lot to achieve this scalability. People who were not earlier able to, access that thing are now at least able to do that. Well, talking about what Shubham, you said that there are only 0.2% people in India who are still accessing telemedicine as an option. You're absolutely right. I think acceptability, adaptability is the question mark we have. People are getting used to it. People like me who are educated, who have been, who have easy access to the healthcare, but never used to it. It is only during the COVID times we started using it ourselves, the telemedicine thing. People are getting used to it, and it is a way forward. So yes, technology is going to rule the roost, and we're going to see a lot of traction in this. A lot of startups and some big corporates also have started making their headway in this, but it still has a lot of scope. I mean, we can scale it up. We can have a lot of people using it in their routine lives. So let's hope for it. Let's hope that people use it a lot, make best use of the technology, and have a better future.
Sure. Often, my father used to say this, that ending on hope is one of the best things that humans can do, and that's what probably makes us human. We have the advantage of being able to peek into the future and yet come out of it and act in the present. Thank you, Amanji, and thank you, Dr. Yogendra, for giving a beautiful beginning to the entire panel discussion. Overall, still public health is a domain of multiple stakeholders. And Yogendraji, you have yourself been a doctor and a policymaker. In terms of how the world is shaped by both, there have been a lot of rapid changes in the last few years. So we see Ayushman Bharat digital mission getting launched a few days back. We have eSanjeevani, a telemedicine platform by the government. We have Health Stack for data storage. You talked about data storage as well. Overall, you also see things on the ground with your engagement with NMO, with your engagement with NMC. You have met and engaged with variety of doctors on the ground. Do you think this is sustainable? Do you think India is ready to engage and accept technology-based public health solutions? Given the large amount of people who are still do not have mobile phones, large amount of people who still do not have access to healthcare. Do you think we can merge the two in some ways? You're on mute, Dr. Yogendra.
It's true. There are many changes in India, specifically in the field of public health in last few years. You have given some examples. I'll give some more. Like we have started individualistic approach, targeted approach for many programs. Like, to give an example, earlier we had tuberculosis, earlier we had anemia, and earlier we had these nutrition, underweight children in our country, and we had different programs for each one of them for their nutritional needs. Now, you must be aware of the Poshan Abhiyan. So, with launching of one program, we have adopted a life cycle approach where each individual during his life cycle, when he's vulnerable or when she is vulnerable, we give him or her the kind of portion which he needs. So this is a big change in Indian scenario. Then secondly, we have come to, like in Beti Bachao, you have mentioned, it was successful because of the integrated approach that many stakeholders should come together and work for something. So that is a bigger change in the scenario of public health in India. Then you must be aware of that we have polio-free India in 2014. Neonatal tetanus has been eliminated from India, and we are now targeting measles and rubella. Now, in TB also is an interesting case. The whole world says that we will be free of TB in 2030. That is their target. Our Prime Minister has given the system, the target is 2025, that we'll do it 5 years before the world does it. So rightly, you have mentioned Ayushman Bharat, and then kind of wellness center concept into it, and building the infrastructure and all. So that was again a technological part of Ayushman Bharat was very important in its implementation, and it's doing wonders. single platform reporting, we had a big problem that we could not generate the data we need for policy making in India. So now we have come out with in NHA, National Health Authority, I told you I'll come to it later, and then National Digital Health Mission also. So what we are basically trying to do is to put technology in the right perspective for the right kind of system in the public health system, so that it's strengthened. And similarly, we have focused on research like ICMR. I am attached with one of the innovative things in the field of devices, medical devices. They are doing is CBio of ICMR. And then we also have many systems in place for inventory management all. So what these are the changes which I have observed over a period of time in last few years. And coming to your question, definitely this is going to get us miles away from what we are now, and obviously it will place us in the right league in the sequence of countries in the world. That's what I believe. Yeah, Shubham, am I clear, or I need to answer?
Yeah, you're clear, Yogendra. Thank you so much for that. You talked about from data and the compilation of data to on-ground mobilization efforts that happened during mass vaccination drives to just fundamentally changing the way we look at our public health systems, from being individually centric to looking at as a collective, to looking at individual selections for each state, to looking at one collective data entry machine for the entire country. Thank you so much, Dr. Yogendra. Amanji, would you like to add anything to what Dr. Yogendra just mentioned?
I also think that, there were, like Dr. Saab rightly said, that, we were lacking in especially when it came to the data thing, the collation of the data, and then putting data in some centralized system which all the stakeholders can use in a proper way to make best use of it, we were lacking at that. Now, when we have all the systems in place, I think India has adopted technology very well, and we have been using it very well. We have evolved from one stage to now that we can use this data in the best possible way. So I totally agree with Dr. Saab that we are now very well positioned at the global stage to make a headway in that.
So, Manji, you in the beginning in your introduction, you mentioned about availability of various how companies have entered into the telemedicine space, and that has been one massive change that we have seen. Probably COVID gave a big boost to it, but that is still massive in itself. We can see Practo ads running everywhere, from metro stations to Google. We can see governments like government entering into e-Sanjeevani. We see mega companies like Tata starting their public health telemedicine softwares, Apollo starting Apollo 24/7. These are massive changes in itself, from big conglomerates starting and using their power and might to drive telemedicine, to young entrepreneurs dreaming about changing the world, getting venture capital, getting good funding, and creating good models that create value with a doctor at distant. Is this the range of how we look at telemedicine in India? Or do you think there is more value addition that can be done with technology? Are we nearing saturation, or are we still very, very far away from it? What's your outlook on that?
I think that we are still very far from the saturation. It is just the beginning. India is a big country. It is the kind of population we have. A very small population is so far using it. I mean, we still need to advertise it properly. We still need to make people know that there is something like this which is happening in India. They need to access it. I believe still it is mostly in the tier 1 cities that people are using telemedicine, or maybe in a couple of cities in the tier 2. We need to reach, we need to do more penetration, we need to evolve better. Whether we talk about the artificial intelligence, chatbots, telemedicine, all these things are still in the evolving stage. We still have a lot of, I think, a lot to do in this space.
Thank you, Amanji. So moving back to Dr. Yogendra. Dr. Yogendra, you yourself are a doctor. I have my medical professional friends, people who are doctors or people who are in the final year and doing the practice along with the hospital. they were so far very, very anti-technology. And this I'm only talking about my friend base. What do you do? I'm a software engineer, so they kept asking me, what do you do in a dabba? What does this do? We do real work. And during COVID-19, suddenly everyone shifted. They very actively adopted technology. People who were on the front line, they used technology to keep themselves safe, to read, to spread awareness. They all had their own WhatsApp groups created for COVID-19. People who were on their in their homes were adopted all the technology tools that were possible, from professors running their classes on online to doctors taking online patients. Overall, this entire shift uh, suddenly also got a dip at the end of the COVID-19 second wave. So eSanjeevani saw a dip in number of patients. All medical, uh, all online health providers saw a massive dip. Uh, Few were concerned that there is no permanency to this change. People still want to go and visit their neighborhood doctor because they know him. People still want to go and get the feel of a stethoscope on their body, touching them, and finally realizing, okay, this is how diseases are felt. Pathology labs will still function. And because the labs will always be physical, doctors will always be physical. Do you think the idea of visiting or knowing a doctor online, or the idea of getting a test online, is feasible in India?
Uh, I would say that everything grows under stress. Our orthopedics professors, they used to tell us when they talked about how the broken bones they join. They earlier they never had this operation and all. They'll put some plaster on it, and from the pressure only they'll join. So they used to tell us everything grows under stress. So what your friend circle told you, I found even some engineers, they were not that tech savvy, and they even wanted, a personal touch to everything. And regarding your question, even my right half of the brain and left half of the brain are divided, and it's so difficult to predict what will happen in the future. But I think they are here to stay. Uh, maybe only few people will adopt them in the initial part, and later on you'll find many takers. To give an example, when we used to prepare for our post graduation, we used to go to the coaching centers and all during our times. And when I was teaching some students last year, I showed them that you are preparing, and we have joined a coaching center. I said, I have never seen you going out of campus. No, sir, we have joined an app actually. What is the app? Is that Mero is an app, and on app the teachers teach. What is this? Is this possible? Then I see for 20 years I'm in this field, and now I'm a professor, but I didn't knew that students are taking classes online already. You know, uh, and for me, it was like, how can somebody teach you online? But when I saw the lectures and they introduced me to it, I found it's very interesting also, and it's good also that so many things which were inaccessible to so many people are becoming accessible to so many. Access is improved. But obviously, even today, when you called me, I consult few of my friends on this issue, that how technology is going to change this or that, and then they were like, everything is good. This telemedicine is also good, but personal touch can never go away. Everybody is like that only, and I think it's completely natural for human beings to seek human touch for our interaction. That emotional support cannot come through online and all thing, at least for now. I think in future, because I've seen few of the gen next people in medical field, they are very comfortable with these new technologies, and even they attach their emotions. I have seen few of the teachers teaching and few of the students commenting, and then the teacher responding to those comments. So I think it's not going to be very easy, the acceptance. We have also prepared one telemedicine helpline. If the third wave comes through one of the NGO, Abhyuday, we call it, and Swami Vivekananda Health Mission in Uttarakhand, what you have mentioned rightly, that there was a huge crowded calls when COVID was there, but now it has dried up. So I think human touch and the kind of emotional behavior we have. I don't know about other countries, but Indians, as an Indian, I think we still need this. And but this technological part will not go away from our life. It has been made a permanent part of our life by COVID, and I think it's going to stay. Earlier, such meetings I would have preferred to come and talk to face to the audience. Now I can see only 2-3 faces. I don't even know who are attending, but I'm comfortable now after say 1.5 year of interacting. So if a person like me can be, I insisted that every meeting should be physical in my life, and last 1.5 years I'm doing it online, and now I'm a bit comfortable also, if I can say so. So I think it's going to stay, but it will take time. That's what my take on it. And for teaching part in professional college, I still believe we need physical classes as well to teach the skills to the students. Rest of them can go online. That's what my take. Thank you.
Thank you, Yogendra. There is balance, there is hope, and there is an aspiration, and all three were well reflected in what you mentioned. Thank you so much for your response and your views on this. Amanji, would you like to add anything to what Dr. Yogendra just said?
Yeah, sure. I think it is also a matter of experience. Now that people have started experiencing the online thing, the online meetings, they started liking, like what Dr. Yogendra said. In the similar way, talking about telemedicine thing, because a lot of people have not experienced it yet. So that is one reason it is still not very famous or very popular. Once they start experiencing it, once they take first consultation, on the telemedicine, I think that will help. Also, talking about all these companies, these apps are working in this field. They should also stress upon taking feedbacks from the customers. I think that can help in making their experience, the customer's experience, the patient's experience better. That will help in maybe promoting, advertising this particular thing at a large scale.
Thank you, Amanji. Amanji, let's move to when you talked about experience. You have a long experience in the insurance sector. Insurance as an industry, and I'm a very, very novice in this, so please pardon me for my ignorance, but thrives on data. The better data you have, the better predictions you can make. And insurance is all largely about taking risks and making bets based on what data you have and how do you think the future might be. Overall, how has the data scenario changed? You have worked across all major health giants, currently acting as the business development vice president. Do you think the whole insurance sector as a whole, because insurance takes care of a large number of people with Ayushman Bharat coming in, insurance takes care of more than 60% of India's health expenditure. How has the sector fundamentally changed with technology?
So this sector has evolved a lot, especially since the time we have adopted technology. Talking about health insurance per se, there was time when it was all about out-of-pocket expenditure for people. Many people could not afford the health insurance. I remember back in 2007 when Ministry of Textile had, 2006 rather, when Ministry of Textile had started a policy for their handloom weavers and handicraft artisans. So it was a very big policy at that time. They managed to cover some 20 lakh families. And now, 13 years, 14 years down the line, we're talking about covering more than 500 million population of India by the government funding or by a government-run, policy. All this have been possible because of the data. Had the data been not there, the identification process would not have been possible in the way now it is possible, and we would not have been able to cover them under the insurance policies. So data plays a very, very important role in insurance, not only in identifying the people as we are talking about, but also, like you said, in predicting the insurance or the losses in future. But a proper data, when a company has a proper data or the sector has a proper data, they'll be able to price it properly and then run it properly. So yes, of late we see a lot of streamlining in the data collection and usage of that data. Talking about insurance, otherwise in the health insurance sector, a lot of improvements have come in that. When it started, when the earlier, there was a scheme called Rashtriya Swasthya Bima Yojana. When it started, it was covering it was giving up, coverage of about 30,000 rupees. Now we are covering, people for 5 lakh rupees. The sum insured has increased, so has the population increased, so has the demand increased. So the demand has gone. People who are not taking the treatment earlier are now able to take those, treatments now because they have this power of spending 5 lakh rupees, which has been given to them. That increase in the demand has also increased the accessibility. And of course, because of this demand, the supply has also increased in terms of the hospitals. I have myself seen maybe in a span of about 2-3 years in the state, the number of hospitals have increased significantly. So that kind of thing that, that an insurance, a properly designed insurance program can bring into the system. So all kudos to the Ayushman Bharat scheme. But still there is a lot of improvement that needs to be done in this. You rightly said that, states, it is a state subject, so states are implementing it in a way, and center has drafted this policy, center has drafted this program. So a lot of improvements are still required. And of course, the governments are trying to make, they are trying their best to do all these improvements.
Great. So this question is actually to both of you, and this is also a personal conflict for me. I come from a technology background, and for me, everything is a technology solution. Often people give very strong remarks on the technology will not be able to solve everything. As Dr. Yogendra mentioned, that you cannot substitute in-person training for a doctor. He needs to know the proper tools to handle a patient. We mentioned about not removing the human touch, and the human touch is very important, and the feel of that someone is there for me is very important for any person to get well. When we discussed this topic with some health experts, when we were drafting the topic and the notes, they have mentioned that there are 3 primary challenges to India's public health problem. They talked about access, and Manji also mentioned about it. They talked about awareness, that people are just not aware that it's a health situation. In some cases, in some bits and pieces that were mentioned across the discussion. And they mentioned about infrastructure, that we do not have the adequate health infrastructure. COVID-19 also gave an exposure, also exposed that to the country and possibly to the rest of the world as well, that we were not equipped to handle such big chunk of cases coming to India. These 3 are very different in each other. And access problem cannot be solved by an awareness solution, and an awareness problem cannot be solved by an access solution. Within these, or any problem that you foresee in the India's public health situation, what is the biggest problem according to you? And is there a technology solution that you can imagine? This can be a data solution, this can be a telemedicine solution, this can be a solution of wearables, this can be a solution of just compilation, this can be a physical setup. What do you think is India's biggest health challenge? Access, awareness, and tech or infrastructure? And can technology solve it?
Shall I?
Yeah, please go ahead.
Yeah, okay. I think we, in this multiple choice world, questions world, we need to have a D choice also. And I'll go for that, that all of the above are the big challenges, not one. We are a big country. We have a huge population, and infrastructure. If you see manpower, equipments, we have a huge burden of disease in our country. So access is a problem, big problem, which we are trying to solve in last few years. Awareness obviously is not a small thing. We need a very heavy BCC, IEC. You must be hearing from IEC. We have now moved to BCC campaign. So this awareness is also important, and infrastructure we cannot do without it. So with such a country with a huge population and such a vast geography, I think all the three are problems. I cannot choose any one of them. They are equally important, and they are hurdles. All the three. Like in India, if I come to infrastructure, then you have to know that we over the period of years have developed a huge infrastructure in health, specifically in public health all over India, and specifically this Ayushman Bharat. We are increasing this infrastructure, be it wellness center or the other insurance schemes for treatment, tertiary care for the patients. In this infrastructure, manpower is also an issue. Earlier we used to have the concept that doctor and few of the people in a hospital can handle it. Now we have a paraphernalia of paraclinical staff along with the nurses in all the hospitals, and they have a huge number, but we still are short in manpower in some of the issues. Doctors, obviously, to give you an example, and you'll be happy to hear that we have been hearing that we have few doctors, and the doctor patient ratio is population ratio is less in our country. WHO says it has to be 1:1,000, but now the seats of MBBS and PG, they have grown like anything in India in last 3-4 years. After 2014-15, I think we can see a huge increase in the seats of MBBS doctors, MD doctors, MS doctors, specialists, and super specialists. So I think we are increasing our infrastructure on ground in manpower and other equipment and infrastructure in other infrastructure terms, but we still need to grow more on every aspect of it. Awareness, if I tell you and to you, just to mention that we have to fulfill our commitment of 2.5% of the GDP allocations. That is also an important thing which we should be doing, and I think we are increasing it day by day. I hope in near future we'll achieve that target also, and the infrastructure will come out. Then awareness, I think this India, as I told you earlier, is a huge country with a huge population, and our health seeking behavior is poor. People are generally economically also they are poor, so this health seeking behavior has to improve. Whatever, even if in some cases we have good infrastructure, the people are not going to it. So health seeking behavior has to improve. Regarding the access, I have to tell you a few of the facts about the reversal of the disease pattern in our country. Earlier we used to have 60% of the communicable disease and 40% of the non-communicable disease. Now because of the increased urbanization and even rural, the villages we used to say, they are kind of semi-urban places. The amenities have improved over a time in our rural sector also, so they are becoming more towards urban kind of thing. So non-communicable disease like in normal parlance we say heart attack, hypertension, diabetes, they are increasing, cancers are increasing, and communicable diseases are going down, barring this pandemic, if we say. So our whole things are changing. So with this, I think the pattern of access to healthcare also we need to revise. earlier we used to have some other policy initiative for communicable disease. Now we need to have, and we are also our policy is not that this new health policy in 2017 it has recognized that now we have to cater to the needs of non-communicable diseases also. So I think coming back to your question that what is the biggest challenge, I will give equal marks to all of them, because if we improve all of them, as I have earlier said, we need integrated approach, and a kind of approach which takes every angle of the thing together so that we can improve. So I think I won't choose one. All of the three will be my answer. Thank you.
Sorry, I was on mute. Thank you, Dr. Yogendra. It's often said that policymakers are always finding it difficult to take a side with any particular idea, and that was well reflected as well. I hope, Amanji, I'll repeat the same question to you. Three big challenges of public health in India: access, awareness, and infrastructure. According to you, is there any, what do you think is the biggest challenge? And do you think there is a technology solution to that?
So I completely agree with Dr. Yogendra. I think all three are major challenges for us. Talking about infrastructure, yes, there are some improvements, but a lot still needs to be done. I think a private sector can play a big role in that. Talking about the infrastructure, if you talk about the access, especially talking about access, there I would say technology has a big role to play. Like I earlier said that, this virtual connect between the patient and the doctor, which was not there earlier, can play a big role here. So accessibility is possible, pretty much possible with the help of technology, which has just started taking place. I can see, technology to play a big role talking about access. Well, awareness in this, I would say more than awareness, acceptability is a bigger challenge here. Maybe people are aware, people are getting aware of it. There are no less means to make them aware of the technology, which is now there to help them, accessing all these telemedicines or chatbots or whatnot. But acceptability is the problem. We have been talking, Dr. Yogendra, in you and me, we have been talking about this thing that we were not, used to this technology earlier. We were all doing the physical meetings. People would travel long distances, especially for these physical meetings. But now, since this COVID times, they have realized that all these meetings, all these things are possible in the online mode also. So it is a matter of acceptability. It is a forced acceptability, but now people are happily accepting it. They're seeing a lot of benefit in it. So it has to come in the telemedicine field. So it has to come in the technology field, the acceptability. I think that is also one of the challenges, along with the three challenges that you just mentioned.
Yes. Thank you, both of you. Overall, if there are various ways in which people acquire knowledge, for me, one of the most enlightening ways is talking to people who know much more than you. And I'm glad to be sitting in both of your company today. Overall public health situation is a multidimensional topic. And the range that we covered today, from the education around public health, education in health, from covering about how people at the grassroots, people in urban areas think, to talking about how we think about public health policy in India, to think about how data gets collected, to talking about what kind of challenges we face, to talk about various technological solutions and the way around it. I'm glad that we, all of us, got a chance to be a part of this discussion. And thank you both for joining us today and enlightening us with your knowledge. That is all for today. Thank you all. Namaste and good evening.
Thank you very much, Shubham. Thank you very much, Dr. Yogendra. Thank you so much. Bye-bye.
Namaste, everybody. Thank you.